Hey, what's going on, guys? And welcome back to another video of Keep It Simple Stupid. Today's going to be a short one, but I think it's important. And what we will be discussing is Pediatric GCS, or the Glasgow Coma Scale, how to calculate it, and when to use it. And of course, we're going to make it simple. So the important thing you're going to ask yourself is, when do we want to use the Pediatric GCS versus the adult one? Because you might be wondering, is it like for someone under the age of 18, under 12, like what's the specific cutoff? But we'll go ahead and discuss that. So here are the times that you will want to use the Pediatric GCS instead of the adult GCS. And actually, it's not too difficult, all right? So you want to think a child younger than 2, a kiddo that has a developmental delay that limits communication, or any child that is pre-verbal. And I remember speaking to a pediatric emergency medicine attending about the pediatric GCS, and really their recommendation was, look, the pediatric GCS is what you will need to use as a provider if your patient can't talk to you. So that was kind of a very simple, basic way that I thought was helpful for my understanding of when I would use the pediatric versus the adult. So with that being said, let's go ahead and actually break down each component of the pediatric GCS. Now, the big thing to remember here is that, similar to an adult, is that your lowest GCS score will be a 3 and your highest will be a 15. I remember someone calling out that a patient had a GCS of 0. Someone cannot have a GCS of 0, right? Just remember a rock has a GCS of 3. So remember, your lowest possible is a 3. All right, so let's go ahead and break this down. So similar to the adult, step 1, we're looking at eye, specifically eye opening. So what you'll need to look for is, do those eyes open spontaneously? Do they open to verbal stimuli? Do they open to pain only, or is there no response? Just going down the line here, you'll see what each one of these clinical findings, what corresponding score that'll give you for each component. Now, this one for eye, it actually doesn't change really at all compared to the adult one. Now, here's where it does get a little more tricky, and that's going to be the verbal response, right? Because that's the question is, right, with an adult, if you ask them a question or you give them a command, they should be able to respond to it or answer you. But with kiddos who are pre-verbal, it's going to be a lot more difficult. So to get a full score of 5, you need to hear coos or babbles. Irritable cry will give you a 4. Cries in response to pain will give you a 3, and then moans in response to pain will give you a 2. Now, I think this could be a little challenging, like, okay, how do I differentiate between a cry, a moan, or a coo? And I think that's something that you may just have to develop as a provider as you're seeing more pediatric trauma patients. All right, and then finally, we're going to go ahead and move down to motor, the big one here. And moving spontaneously or purposefully, that's going to give you a 6. So withdrawals to touch is a 5, withdrawals to pain is 4, flexor posturing to pain is going to be a +3, extensor posturing is a +2, and then no response is going to be a +1. All right, guys, that's all I have for you today. Again, short and sweet. As always, guys, like, comment, subscribe. If there's any specific topics you'd like me to cover, as always, please let me know, and I'll see you guys next time.